Hey everyone, it's Dr. Russell, and this week I have a little bit of an in-depth video, so I'm hoping to keep it as short as I can, but I want to talk about the different kinds of integrative and alternative practitioners that are out there, kind of what the training looks like, and what conditions and things in general they are good for, because I know I refer a lot myself out to a variety of alternative and integrative practitioners, and I think there's a lot of confusion and misinformation out there, and just sometimes I know people are a little hesitant to try different things just because they don't really understand what it is or what the person has been trained with or is involved. So I just wanted to do a kind of brief summary of a variety of integrative practitioners. And I will just say off the bat that I'm not covering every single type of integrative and alternative practitioner out there. So I apologize if you are one of those and I'm not including you on this list. You are still loved. It's just, we only got so much time and I don't want to create a, hour-long video for you. So I'm going to start this with kind of the history really briefly, and as I go through each type of practitioner, we'll say kind of in general what they'd be good for if this kind of fits your needs. So I will just as a caveat say, and the reason why I'm doing this is there is a lot of misinformation on the internet in general, which I don't think comes as any surprise to any of you, but especially things like Wikipedia. It is an open platform. Anyone can really edit things like Wikipedia. It's not, an encyclopedia that has been vetted and researched and we, have good factual information. So there have been things like for my medicine, naturopathic medicine, that has been altered and has been basically the page is not allowed to be edited anymore because there's been so much back and forth between us trying to correct the information and then misinformation being put on there. So stay away from Wikipedia in general. It's really not a good fact source. So I just have that caveat. So let's start kind of way back with a couple modalities that have been around for a very long time, and that is acupuncture and herbalism. So herbalism, using plants basically as medicine, we have thought, it's through pretty much every native culture, there's some form of herbalism being used. So it's thought that it's kind of evolved with us as we've evolved as humans. So thousands and thousands of years, likely herbalism has been around. It's become more formalized over the years, which is great just because now with medications, things can get interacted with. So it's always good if you're on medication before you start playing with herbs to talk to someone that is either a registered herbalist or a Chinese medicine who uses acupuncture but also has herbalism training, or a naturopathic doctor. Those are kind of the top three people that are trained proficiently to best understand those kind of interactions, because that can be dangerous. Herbalism is amazing. I use botanical medicine, which goes together all the time, and it can treat a variety of conditions. So the one thing I will say is that herbalism may not, if you're eating poor and maybe eating McDonald's and things like that, herbalism can only do so much. But if you're doing kind of a lot of the right things and you just need some more rebalancing, herbalism can definitely help. And there's herbs for pain, digestive issues, fertility, hormone balance, mental health. The list goes on and on. So herbs can do a lot, thankfully. Nature is medicine, which is wonderful. And then acupuncture. So acupuncture also been around for thousands and thousands of years. And thankfully, I would say for both acupuncture and herbalism, we found that more research that's being done actually shows really positive results for both of them. So it's amazing, things that have been around for a very long time actually do work. Acupuncture, I'm sure you're familiar with the idea, using little needles that really mostly don't hurt. They're very, very tiny. And it works to help kind of balance your body's energy. For acupuncture, it treats a variety of conditions as well. I love referring people out for acupuncture. Even though it sounds like it wouldn't be because of needles, it is a very relaxing treatment. A lot of times you just fall asleep because it's so wonderful, but yeah, it helps with digestion, pain, fertility, mental health, I mean, the list goes on and on. So there's not much acupuncture can't help with, thankfully, which is wonderful. So those are kind of I would say the oldest modalities, or things that we've known about for a very long time. And if we move forward to kind of the late 1700s, then we have homeopathy. And I'm not the official spokesperson for homeopathy, so this is just my kind of opinion and observation, but I feel like it works very similarly to acupuncture in that it kind of stimulates and supports that body's own healing. We don't really know how acupuncture works, just like we don't know how homeopathy works, but we know they do work. Homeopathy, it kind of similar to herbalism in that it can help, but again, if you're eating poorly and you're stressed out all the time, it can only do so much, but it is good for a variety of conditions as well, including pain, mental health, kind of all the things I listed. So it's a great modality. Then we jump forward a bit to kind of the late 1800s, early 1900s, and we have an emergence at this time of several more kind of integrative and alternative modalities. So this is when we see chiropractic come up, osteopathic medicine, when it's definitely shifted to what it looks like today, is very different than how it was originally practiced. Naturopathic medicine, what I do around that same time as well. So all three of these all really emerged around the same time, which is interesting. Obviously, chiropractic and DOs, which is how they're referred to, is really well known. There's about 70 to 75,000 of those each practitioners in the US today. And naturopathic medicine, unfortunately, is not as well known, but we still do great things. Very clinical training, medical school training. Essentially, we all get the same basics, anatomy, physiology, all that stuff. Just how we treat is a little different. So like I said, osteopathic is now more of the line of kind of MD, conventional, but their training is, I would say, similar in chiropractic and helping the nervous system in the body rebalance itself. So overall, those are good for kind of, I would say, a lot of general conditions as well. Especially with chiropractic, we think a lot with pain and things like that, but because it helps balance the nervous system, it's also good for digestion and stress and endocrine function. So it can do more than just when we think the neck cracking and everything, because it helps balance. And then for naturopathic medicine, we integrate kind of a lot of different modalities, which is wonderful. So we can use things like herbalism and homeopathy and nutrition and all that, but really getting to that root cause and kind of truly integrating all those together. Obviously, I'm a little biased, but we have been around for a very long time and also use things that have been around for a long time. So that's great. Then if we bump forward a bit, we have Reiki kind of next up. It was originally started in the 20s, and then was one guy that was passed to one woman who passed it to 20 or so other people. When that transition took place, it's not really clear, so I would just guess around the mid-century is when it started expanding, and then obviously I would say in the last couple of decades has really taken off quite a bit. Reiki, it works on an energy level, so it is really light touch or no touch, and you might feel different sensations, but it can help with pain and some other kind of chronic conditions, and at the very least people usually leave feeling very relaxed, so that's a nice benefit for that. And then also kind of mid-century, a little bit later, is craniosacral, and craniosacral has its original foundations in osteopathic medicine, so it does come from a longer line of tradition and teachings, but similar in some sense to Reiki in that it helps rebalance the energy, just lets your body kind of do it on its own, but also great for pain and nervous system, endocrine balance, even I've seen for some people fertility, but I would say for a lot of those, just kind of relaxation and chronic pain and things like that can be really helpful. That being said, I've seen those do also kind of all kinds of amazing things. Similar to Reiki, and that's just light touch. And again, sometimes you just feel relaxed. Sometimes you might feel things moving and heat and cold sensations, but definitely a really enjoyable modality. And sorry if I'm rushing through. There's a lot I'm trying to get through. And then we moved to more recently, we have the development of things like life coaching and health coaching, which were the 80s and the 90s. So I would say these practitioners are good if you you know what you need to do, but you struggle with actually, getting that done. So good for keeping accountability or just inspiring, and maybe having some, new ways of looking at things, and kind of, I think of it almost like a really good friend that just like is on your side, encouraging you and giving you those great tools and tips that you kind of need. So they definitely have a place in integrative and alternative healthcare. So really helpful. Just, they don't have maybe as much as the medical training piece, but a lot of our conditions today we know are just from not eating well and not exercising and moving your body and things like that. So if those are the things you're struggling with, a health or a life coach can be really helpful. Or maybe you just feel stuck in your job or anything like that. And then kind of another definitely more recent modality would be functional medicine. And that was also in the 90s. And that is, kind of looking at, I guess, balancing the body and kind of helping on a more functional level. So looking at things like nutrition and supplements and things like that, and going a little bit deeper than conventional medicine. So there's a variety of functional medicine types of practitioners. So it kind of is almost an overlap on some of these. So you could be a health coach that has functional medicine training. You could be a acupuncturist that has functional medicine training. You could be a conventional doctor with functional medicine training. So it kind of just is an added, I would say, training to all these other modalities. So it can help with some chronic conditions. I would say most functional practitioners that I know of do specialize in certain areas. So just kind of maybe finding one that specializes in the area for you. So now I want to get to the really important part. So hopefully you stayed for this. If so, I really appreciate you still watching. So this is my kind of top 3 questions that I think are crucial to ask any of those practitioners that you want to work with or you're thinking about working with. And again, there are so many more. There's reflexologists. Obviously, counseling is amazing. The list could go on and on. I just don't have time. We don't have time to talk about all those other great ones. So first one, very important. And I will say that a lot of more of the well-established modalities, so naturopathic, acupuncture, chiropractic, osteopathic, they're very rigid and defined certifications and trainings and licenses involved with these. So when someone calls themselves, for the most part, an osteopathic doctor, an acupuncturist, there have been rigorous guidelines set up, so this person has been trained very well and has passed their board exams and everything. The only caveat I will say is for naturopathic medicine, well, in Maryland, it is licensed, so anyone that is calling themselves a naturopathic doctor should technically have a license. They've gone to an accredited school. Obviously, we are surrounded by states that are not licensed, so that's where you want to ask some of these questions. If you're in a licensed state for naturopathic medicine, which you can check at naturopathic.org, then you should be safe. But definitely, it's always still good to ask these questions. And then as far as the other ones, they're mostly certificate-based, so that's where these questions come in handy to understand what the training is, because there's not as many standards for the other modalities that I mentioned. So yeah, what kind of training did you have? And was it hands-on? Was it all just online? Was it in person? Was it a weekend class? Was it a couple weekends? Was it years? What did that training look like? What was involved in that? And most importantly to me is, was it clinical based? Did you actually get to work with clients or patients? Or was it you had to write up a case study, or maybe you saw 10 people that was part of your requirement, or was it thousands of hours that were required? Because there, like I said, is quite a variety as far as training and standards, because it's, for some of these, everything has a place, but the certificate, it's pretty easy to get one, so you really want to know what kind of person you're working with. Another important thing I would say for any healthcare practitioners, have you treated this before? And I know I always make it a point to be very transparent and upfront with that. Yes, I've seen a lot of patients with this condition and have helped, or, I've seen a handful, so just want to be honest about that. Or, for some people, sorry, I have never seen anyone with this before, but I'm willing to do the research and figure it out. But it's definitely good to at least know if someone has a lot of experience with someone with your kind of condition or concerns, or, would this be totally new for them and you want to, maybe they're not the best fit and, want to kind of manage those expectations. And then the other kind of key thing that I found that can help distinguish more between, is someone still kind of on the conventional care side of things, or is it really truly integrative and more alternative, is asking about what's called protocols. So protocols is a very conventional care term. I mean, you get breast cancer, there's a protocol for that. You follow it to the letter. If something doesn't work, you go to this next protocol. If you have diabetes, this is the protocol, the standards of care. When it comes to more integrative things like acupuncture, herbalism, naturopathic medicine, we kind of stay away from protocols. So, there might be some general things that we know work for these conditions, but each person we want to treat individually. So there is maybe a set of acupuncture points or a protocol that we know that's good for example, constipation, but they should also be adding in individual points based on your pulse diagnosis and your tongue diagnosis, that take into you as a whole picture. So if someone's really just following protocols and giving the same thing to people that have the same condition, it's not truly individualized care, and it's really not getting at the heart of integrative and alternative medicine. So that would be another good question to ask. So to sum it up, what kind of training, what was involved? Did you actually see people in person, or was it, online, or, what did that look like? How many clinical hours, I'd say, would you actually got? And then maybe if it's not a lot, how long have you been practicing this training? How long have you been a health coach for? I mean, if someone's been a health coach for 10 years, I would say they probably know what they're doing. Have you treated this before? Is this something you're comfortable treating? Have you seen a lot of it? What's been your experience? And then do you follow protocols or not? Is it something you do more individualized care, or do you kind of have the same thing you give for everybody? And I would use the term protocol because obviously they shouldn't say they get the same for everybody. So hopefully that was helpful, because there is a lot of misinformation, and sorry this is a bit of a longer video, but I just want to make sure you feel really empowered and kind of know the right questions to ask, and at least have a brief overview of these different and wonderful modalities that each have their own place. And if you've tried any, please share in the comments and what your experience has been. And I know people are always surprised at how, again, relaxing things like acupuncture is when it involves needles, but there's definitely a lot of a place for a lot of these in our medicine that makes up the integrative community. So hopefully that was helpful, and I hope you all have a good rest of the week, and I will see you in 2 weeks.